Welcome everyone to today's webinar, Taking the Financial Health Pulse of America. We're thrilled to be here with you this afternoon, sharing insights from the 2018 baseline survey from the U.S. Financial Health Pulse. My name is Thea Guerin. I'm a director at CFSI, and I lead the U.S. Financial Health Pulse initiative. I'll be your host for today's discussion. I'm also joined by my colleague, Rob Levy, Vice President of Financial Health, who will be kicking us off with an overview and an introduction to the broader initiative. We've got a jam-packed hour ahead for you. We'll begin with an overview of the initiative. I'll then dive deep into the methodology behind the measurement, behind the 2018 baseline survey. Then I'll share with you some initial results from the 2018 baseline report. And I'll then conclude with a few thoughts on looking ahead and next steps for this exciting initiative. We will be taking questions as we go. You can enter questions into your screen on the on the bottom right-hand side of your webinar panel. And I'll be pausing for questions after each major section, so please do enter the questions as you go. With that, I'd like to turn it over to Rob to share an overview of the initiative itself. Rob, take it away.
Thank you, Thea. Can you hear me okay? I'll take that as a yes.
Again.
Great. Well, thank you everyone for joining us on the webinar today. We have an incredible number of people on the phone and following online, and we're really excited to be sharing these results from the U.S. Financial Health Pulse with all of you. I'm just going to give a few remarks. The first thing I want to say is that this is a very complicated time in our country. I think we all know that. And it has perhaps never been harder to understand the state of the American economy than it is right now. With so much influx around the political uncertainty, trade uncertainty, changes in the markets, changes to credit, changes to savings, changes all across the way people are managing their financial lives, it can be really difficult to understand how are people actually doing. And part of the problem is that the economic indicators that we have to help us aren't really doing the job. And that's because things like the S&P, GDP, unemployment, even wages don't really attack the entire issue and don't help us understand how financial health looks across the country and for different pockets of the country and different populations. And that's where financial health as a framework is so powerful. It's a composite framework that brings together people's ability to spend, save, borrow, and plan, and helps us think broadly about how their financial lives are working so that from that data at the individual level, we can begin to aggregate up from there to bring new indicators to light so we can understand the state of our economy. And that's essentially what we're trying to do here with this work. The U.S. Financial Health Pulse is a groundbreaking research initiative that provides an ongoing snapshot into the financial lives of Americans. We are so excited to be doing this work with a number of funders and partners. And we are really grateful that we have funding for this work for the first 3 years, which is going to allow us to do this work not just once, which you'll be hearing today, the results from the first study, but multiple years, looking at changes over time and try to understand this new indicator and to understand the changes in Americans' financial health. The goal here is to inform a very broad audience of stakeholders across the ecosystem of financial health, which includes industry, includes the banks, credit unions, includes the startups, it includes the policymakers that have a huge role, nonprofit actors, et cetera, in this space. And we're so happy that so many of you are joining us on the call today. And the second main goal is also to provide data. We'll be releasing the data publicly, which we will talk about, and we're hoping that what we find in this data will inspire innovation to help address these problems with new solutions to improve Americans' financial health. Slide with our funders. I just want to take a quick minute to thank our funders that make this possible. Omidyar Network is the lead funder for the Financial Health Pulse. We are also joined by the MetLife Foundation, who is CFSI's ongoing sponsor of our financial health work, and AARP, who we're very excited to be working with in this project. I should also note that we're doing a special project with AARP's foundation arm, to release a special report on the financial health of low-income people over the age of 50. That will be coming out in Q1 of next year and will be a special slice of this data focused on that population. We also have two really important partners in this work, and that's USC Economic and Social Research, We are working with them to field the survey and also to collect transactional data. They have been incredible partners in this project and really bringing a lot of expertise and rigor to the work that we're doing. And then we're working with Plaid, who is our exclusive data aggregator partner in this project. Finally, we have an incredible list of advisors, an advisory council of experts in the field from across the industries I've mentioned, and many people that are informally advising us that without them, this would not be possible. I'll also say that if you are interested in being a partner in this work, whether it's as a funder, whether it's as a research partner, or as an advisor, Thea will talk about some opportunities at the end of the call of ways you can get more engaged. So with that, I'd like to pass it over to Thea, the lead for the project, to go over the methodology and share the results from the first study. Thanks, Thea.
Thanks, Rob. Perfect. With that, let me dive into the study methodology. So there are two primary components, two primary data sources that comprise the U.S. Financial Health Pulse. The first is survey data. So we are planning to collect survey data from an ongoing representative panel of Americans to shed light on the financial health of people in America at a very high holistic level. We are also planning to marry insights from the survey data that we collect with financial health insights from transactional data that we collect. And I'll speak in just a moment about how we plan to collect these two sources of data, but it'll be the combination of the two data sources that really give us a comprehensive view into the financial lives of Americans. Survey data will provide us with that holistic, generalizable understanding of the entire U.S. population, whereas transactional data will allow us to dive deep, to collect nuanced, granular, and ongoing insights about the financial lives of Americans. And on the next slide, you can see how we plan to collect these two data sources and how these two different work streams fit together. So we plan to field annual ongoing surveys for the next 3 years. We fielded the very first of these surveys this year in 2018, and that's the results that I'll be sharing with you in just a moment, come from that initial baseline survey. Then you can see in 2019, we'll field the second benchmarking survey, we'll field the third one in 2020, and so on. As Rob mentioned, we have indeed secured 3 years of funding for this initiative, but we hope that this, and we are optimistic that this initiative will last far beyond those initial 3 years of funding. We are, as Rob also mentioned, partnering with the University of Southern California's Center for Social and Economic Research to collect this survey data. So the 2018 baseline survey that I mentioned, the USC team, in partnership with us, fielded that initial survey to their online representative panel. We had over 5,000 respondents respond to that initial survey. And the surveys that we'll field, these ongoing annual benchmarking surveys, will have a hybrid cross-sectional longitudinal design. So for the 2019 survey, we'll be inviting a subset of those 5,000, we'll be inviting all of those 5,000 individuals who responded to the 2018 baseline survey. We'll be inviting that entire cohort back to respond to the 2019 benchmarking survey, while also refreshing the sample with a new wave of panelists to ensure that the sample remains representative of the entire country. We'll do the same process again in 2020 and so on. And that way, this hybrid study design will allow us to track changes in financial health, both at the national level as well as at the level of the individual or the household. Starting in 2019, we'll also begin to collect transactional data. So we'll be inviting a subset of those 5,000 USC panelists who responded to our 2018 baseline survey. We'll be inviting a subset of these individuals to consent to share their transactional and account records with us through a partnership with Plaid, who is offering data aggregation services to this project. So with a USC designed front end, a Plaid powered back end, these panelists who responded to the 2018 baseline survey will be invited to share their account information with us, just as you, using a mint.com, would be invited to link your various bank accounts, your checking account, your savings account, mortgages, 401ks, etc., just as you would do that on mint.com, we will set up a very similar sort of interface and infrastructure for these panelists to consent to share these transactional data and records with us, to really give researchers, ourselves, the USC team, and others an unprecedented view into into measuring financial health based on these transactional records. And we'll spend some time investing in building a framework to bring together all of these different records, all of these different components that we'll be able to observe in financial health into some sort of a composite index that ideally incorporates insights from the survey data as well. And when I say composite index, I don't necessarily mean one single number. It may be two different headline numbers. It may be a series of scales. It may be really, the possibilities are endless for how we eventually package this information. But here I'd like to make the point that by 2020, we do intend to bring together the survey data collection along with the transactional data collection to tell this comprehensive story about financial health in America and indeed how it's changing over time. Having the survey data and the transactional data from the very same study participants will also allow us to draw compelling insights about how self-reported, somewhat more subjective data assessments of financial health may differ from those that we can see in the observed or the transactional and account records. That's the fundamental study design of the Pulse. The other methodology I want to share with you that will inform today's conversation is a little bit more about the 2018 baseline study. And again, for the remainder of this webinar, I'll be sharing results from that initial survey. As I mentioned, we sampled approximately 5,000 individuals from the University of Southern California's Understanding America study panel. It is an online, nationally representative panel of people in America for individuals who do not have Wi-Fi connection or internet at home. A tablet and a Wi-Fi connection are provided to ensure that we are indeed receiving a representative sample of Americans. The study was live earlier this year from April to July of this year. The survey was fielded in both English and Spanish, and participants could select which language to complete the study in. We had just over 5,000 individuals respond to the survey. The survey itself was approximately 24 minutes in length. That was about 180 questions. And I already mentioned this hybrid study design of the study being both longitudinal and cross-sectional over time. The other component of the methodology that I'd like to address before we turn to the study results is our fundamental financial health framework. And for those of you who have spent time in this space, you've likely heard a number of different definitions of financial health or financial well-being. But here at CFSI, when we talk about this term financial health, we define it as such, that financial health comes about when your daily systems work well and allow you to build resilience and pursue opportunity over time. So you can think of it as a three-part definition. Daily systems work well, allow you to be resilient, and pursue opportunities over time. This definition, though, is admittedly fairly high level and aspirational. So in order to operationalize it for ourselves, for financial service providers and others looking to measure their customers' financial health, we at CFSI have invested the last few years in operationalizing this framework. We've developed 8 key indicators which really provide the foundation for our fundamental financial health framework, and I think many folks on this webinar are likely familiar with those 8 indicators, but for those of you who are not, I'll go through them very briefly on this slide. Essentially, an individual is financially healthy if they are able to spend less than their income, pay their bills on time and in full, if they have sufficient short-term and long-term savings, a sustainable debt load, a prime credit score, appropriate insurance, and they're able to plan ahead for expenses. And we've taken the indicator framework one step further in order to operationalize it, in order to make it useful, and in order to make the results from the framework digestible. And that's through this building of a financial health score, the CFSI financial health score. For those of you who are unfamiliar with the score, I'd encourage you to take a look at a toolkit that we've built for financial service providers via the web link I've provided on this screen. But by way of a quick overview, the financial health score methodology is based on individuals' responses to these 8 survey questions that align with the 8 indicators of financial health. So for every customer, or in this case, every study participant who responds to all 8 survey questions that align with these 8 indicators, one overall financial health score can be generated along with 4 subscores that correspond to these 4 primary components of an individual's financial life: spend, save, borrow, and plan. And it is indeed it provides this composite measure as well as these 4 sub-measures to provide directional guidance on the financial health of individuals, in this case, a group of individuals representing the entire US population. So with that, I'm not going to go too much deeper into the score itself, but I do encourage you to explore the toolkit online at cfsinnovation.org/score. On that website, you'll find both the scoring logic as well as a comprehensive memo about the methodology and how the score was developed. The final thing I will say regarding the score is I wanted to share this key to help folks on this webinar interpret the scores, because the results that I'm about to share with you are indeed based on this fundamental framework of the financial health score. So the score is based on a scale of 0 to 100. Again, every individual who responds to all 8 questions will receive 1 overall score in those 4 subscores that I mentioned. So scores and subscores in the range of 0 to 39, individuals with those scores are considered financially vulnerable. And so these are individuals that report few healthy outcomes, few or no healthy outcomes across those 8 indicators of financial health. I'll show you a little bit more about what that means in a moment. Individuals with financial health scores and subscores between 40 and 79, these individuals are considered financially coping. They report healthy outcomes across some, but not all, of those 8 indicators of financial health. And last but not least, individuals with scores between 80 and 100, these individuals are financially healthy. They report healthy outcomes across all, or at least the vast majority of those 8 indicators I shared earlier. So let me pause here and see if there are any questions about this methodology before I dive into the results themselves. I had a question. First, let me off the bat address the question that indeed we will be making a recording of this webinar available, as well as the underlying deck. So rest assured, you don't have to take screenshots madly. All of this information will indeed be available. I also had a question about whether the survey will be administered to people who are banked, or will it also include people who are unbanked. Indeed, the survey itself was fielded to individuals with bank accounts and those without bank accounts, and so we do have that nationally representative understanding of financial health by banked and unbanked status. I think perhaps somewhat more interesting, I'll interpret that initial question in a different way, and that's that the transactions that we collect, due to the very nature of collecting transactional records, that component of the study will be primarily focused on individuals with bank accounts, but we are actively thinking about how we can account for transactions that occur in cash. It's not, it's a tough methodological question, but it's one that we are paying great attention to, given how important it will be to get that representative understanding and to learn what we can about how individuals without bank accounts are indeed spending their money, but it is a tricky and a challenging question that we look forward to addressing. There was also one clarifying question about Mint.com, and I apologize if I was being confusing there. I simply brought up Mint.com as an analogy for the type of infrastructure that we'll build to invite study participants to share their transactional records with us. So we are not partnering with the folks behind Mint.com. USC is going to be building the front-end interface of a website that their study participants, their study panelists will log into. And again, it'll simply resemble what you might see if you use Mint.com. The underlying infrastructure of the data aggregation will indeed resemble that of Mint.com. However, it will be powered by Plaid, the data aggregator I mentioned. The other big difference between what we'll be doing and what Mint.com does is that we will be keeping our study design as sleek as possible so as not to bias any of the results. Mint.com provides value to users. That's their business model. That's why they use it. We will simply be designing an interface that is effective, that works well, that assures study participants of their security and privacy of their data without attempting to bias our study results. Let me take one or two more questions. I have a question around how large of a subset of the 5,000 individuals will be invited to contribute to the transactional data gathering. That is still up for discussion. I believe we'll be targeting around inviting 500 panelists to participate in the initial wave of the study, expecting that around 100 will consent, but we see that as being the pilot phase of this transactional data collection. So we'll be doing that for the first half of next year, understanding what we can glean from the first 100 or so participants and their records that we see, with the goal of scaling up that pilot by the end of 2019, such that we can have a far larger, let's say, again, all of this needs to be determined, but let's say approximately 1,000 individuals. It would be our goal for the end of next year. I do want to mention something about sample size. So 5,000 individuals, while it's completely adequate to be representative of the US population, it is somewhat limiting in that it doesn't allow us to collect representative insights below the level of the nation. So it's not large enough, with the exception of one state, it's not large enough to provide statewide insights, and it's certainly not large enough to present county or municipality insights. So we are actively thinking about how we increase the size of our sample such that we can gather some of these more representative insights at the state and local levels. And one way we'll do that is that as the USC team actually increases the size of their online panel, we'll be increasing the size of our study population. So going from 5,000 this year, as we refresh with that new cohort, that new wave of panelists I mentioned, continuing to grow our sample. But I want all of you to hold on to that point, because I'll talk about at the end ways in which entities who are indeed interested in getting some of these deeper insights focused on municipalities, how there may be opportunities to run parallel studies using this methodology based on a population of particular interest. So with that, I know there's a couple more questions. Let me pause here, let me keep going, and happy to come back to some of these questions at the end if I have time. So without further ado, I'm pleased to be sharing the initial insights, the results from the 2018 baseline survey report. And starting at the very highest level, we found that only a fraction of this country could be considered financially healthy using our fundamental definition of financial health, that financial health score methodology that I shared with you. So we found that 28% of Americans, that's approximately 70 million people, can be considered financially healthy. And again, these are individuals who report healthy outcomes across each of those 8 indicators of financial health. A sizable majority, plurality here, more than half of Americans are considered financially coping, approximately 138 million people. These are individuals in that middle tier of financial health who report healthy outcomes across some but not all of the 8 indicators. And then 17% of people in America are considered financially vulnerable. That's approximately 42 million people who report few or no healthy outcomes across each of those indicators. And you can see on the next few slides exactly what it means to be financially healthy. So those, and coping and vulnerable. And so those who are financially healthy generally say that they are spending less than their income, that they pay all of their bills on time, they have sufficient short and long-term liquid savings, manageable debt loads, prime credit scores. They're confident in the coverage of their insurance policies, and they plan ahead financially. Those who are financially coping generally spend less than or about equal to their income. They pay nearly all, but not all of their bills on time. Some have sufficient savings, but not all. And the number of living expenses, months of living expenses, differs significantly in this group. They're somewhat confident in their long-term financial goals. They have mostly manageable debt. They have a mix of prime and non-prime credit scores. They're somewhat confident in their insurance policies, and they mostly plan ahead. And I think you're starting to get the pattern here, so I'll let you read the financially vulnerable screen yourself. But again, remember that this is based on those self-reported insights from the initial survey that we fielded. Once we get the transactional data, we will be able to link up these self-reported insights with what we see from the transactional records, the inflows, the outflows, how the balances of various accounts are changing over time. In the initial 2018 baseline report, we also explored financial health by demographics. And perhaps not surprisingly, we found that financial health is not distributed equally across the country. Some groups of people in America are more likely to be financially healthy than others. For example, older Americans are more likely to be financially healthy than younger Americans. Higher income Americans are more likely to be financially healthy than those with lower incomes. White Americans are more likely to be financially healthy than Black and Hispanic Americans. Men are more likely to be financially healthy than women. And those who are employed full-time are more likely to be financially healthy than those who are employed part-time. However, we found that demographics were not necessarily deterministic of financial health. So we analyzed our data, we segmented by household income, and we found that approximately 15% of individuals with annual household incomes less than $60,000 a year were financially healthy. We did the same analysis for those with household incomes, annual household incomes above $100,000, and we found that 50% of this group, half of this group, was considered financially coping or financially vulnerable. And we have more analysis to do here to understand the behaviors, the attitudes, the sentiments that characterize each of these two groups. There also could be some interesting analysis that we do based on household incomes with respect to costs of living. Certainly deeper to dive into these findings here, but I wanted to share them now because it's important to point out, it's important to understand that while income, household income, is indeed correlated with financial health, it is not deterministic of financial health. Or said another way, you cannot simply predict financial health, one's financial health, based on knowing their income. This also has interesting implications when we start talking about the behaviors and attitudes for what financial service providers, what other entities can do to help improve financial health in America, aside from simply giving everyone more income, which, you know, wouldn't that be nice? In the 2018 baseline report, we do a very deep dive into the 8 indicators of financial health that I mentioned. And so I have a couple of the snapshots of those 8 indicator highlights here on the screen. We found that nearly half of Americans are spending more than or equal to their income. More than a third of Americans are unable to pay all of their bills on time. Nearly half of Americans do not have enough savings to cover 3 months of living expenses. That was self-defined by those individuals, how much they thought they would need to cover 3 months of living expenses. More than a third of Americans are not on track to meet their long-term financial goals. Nearly a third say they have more debt than they can manage. More than a quarter do not have prime credit scores. more than a third are not confident about their insurance coverage, and 40% say they do not plan ahead financially. So again, in the report, we dive much deeper into, and we really tell a series of vignettes across each of these 8 indicators of financial health. We don't have time to go into each of these vignettes on this webinar, but I did want to share just a few highlights from the report in each of these subsections to give you a taste of what you, of the insights you might glean if you take a look at the report itself. So beginning with spend, the nearly half of Americans who say their spending equals or exceeds their income, for some of these individuals, for a plurality, 41%, said that their spending equals or exceeds their income because their income or expenses were unusually high over the last 12 months. However, more than a quarter of these individuals said that their spending, of the individuals who said their spending equals or exceeds their income, more than a quarter of this group said that their spending always exceeds their income, suggesting that this is a permanent state of affairs for millions of Americans. We also found that when spending equals or exceeds income, Americans overwhelmingly turn to credit to make ends meet. So among those respondents who said their spending exceeded their income in the last 12 months, 43% used credit to make ends meet. Only 10% turned to savings, and this is specifically savings not set aside from retirement. Only 10% of those individuals who said their spending equals or exceeds their income turn to savings to make ends meet, pointing really, I would say, to both the savings crisis that we have in this country as well as the availability of credit for some Americans. Looking at saves, the nearly half of Americans who lack 3 months of liquid savings, these sentiments were corroborated in self-reported data on account balances. So we did indeed find that, again, based on these self-reported metrics, savings balances were quite low across Americans, with those at the higher end of the financial health spectrum obviously having more savings than those at the lower end. Yet these low savings balances obscure the fact that many Americans say they are saving when they can. 79% of Americans say they are saving regularly or whenever possible in savings accounts. 76% say they're saving regularly or whenever possible in cash. 70% in other savings vehicles. And we see similar trends when we look at the data around long-term savings. As all of you know, we have a retirement savings crisis in this country, very low savings balances across retirement savings, but indeed Americans do say that they are saving when they can. Moving on to borrow, nearly a third of Americans say their debt is unmanageable and that this unmanageable debt is having a significant impact on other aspects of their lives. So amongst respondents who said they had unmanageable debt, more than a quarter said that that debt has prevented them from saving for retirement, and a fifth of those who are financially vulnerable and say that their debt is unmanageable say that this debt has delayed or prevented them from retiring themselves. And this idea, this relationship between the savings that you have today and your ability to retire is something that we explore further in the upcoming segment deep dive that Rob mentioned, funded by the AARP Foundation on the financial lives of low and moderate income Americans over the age of 50, which will be released in January. And I think perhaps most alarming when we look at some of these debt indicators is the fact that millions of Americans say that their debt is here to stay. So 42% of respondents believe that they will still have their existing debt in 5 years, at least 5 years from now. They will still have the debt that they have today, assuming that no new debt is being taken on, really pointing, I think, to the pervasiveness of this problem, of this challenge, and the fact that it is likely to not disappear anytime soon. And last but not least, we look at planning. So 40% of Americans don't agree with this statement that their household, their family is always able to plan ahead financially. But once again, we find that these overall metrics only tell part of the story, because indeed we see that many Americans are trying to plan ahead in various ways. Nearly half of respondents say they use a budget to track their spending, 41% say they have an emergency savings account, 36% say they use automatic transfers to transfer money to savings accounts. And I would say that this is heartening, these numbers around planning and saving behaviors, because we found that these behaviors are associated with financial health. So to size this association between some of these behaviors and financial health, we ran a multiple regression analysis to take a look at the impact of, or I should say the association or the correlation between these behaviors and financial health scores, which again provide the basis of this entire methodology. And so conducting this multiple regression analysis, holding constant all the other demographic variables, we found that individuals who say they have an emergency savings account on average have a financial health score that is 16.5 points higher than those who say they do not have an emergency savings account. And you can see the size of the correlations with each of these other financial behaviors and attitudes. So again, this analysis is preliminary. It really, I'd say that we have far more analysis that we can do, that we plan to do in the coming months and years, to continue to explore the types of behaviors beyond simply planning and saving, the types of sentiments, the types of attitudes that are indeed associated with financial health. But again, I would point to this as a somewhat positive finding that indeed there is something that financial service providers, that financial coaches, nonprofit practitioners, and certainly others can do to improve the financial health of their customers, of consumers, or of those across the country. So again, let me pause here before I move on to the final section of the webinar and take a few more questions that are coming in. I have a couple questions, a couple basic questions. The financial health score itself is based on 8 multiple choice questions. Again, if you're unfamiliar with those questions or the scoring logic, I'd encourage you to take a look at cfsinnovation.org. Do any of the participants represent college students? Indeed, we have a significant amount of college students represented in our data set, along with really any other group that you can imagine, because the data is nationally representative. So I'll give you a few links, a few takeaways at the end of this presentation. But if anybody is interested in doing a specific segment deep dive, in understanding how financial health differs by various population segments, that's certainly analysis that we'd be willing to do. And to get a sense of the types of questions that we asked, I'd encourage you to visit the usfinancialhealthpulse.org website, because we have made the questionnaire itself available to be explored. I had a question around individuals versus households as a unit of analysis, and this is a question that comes up fairly frequently. Because of how our 8 indicators are worded, the fact that some are necessarily need to be measured and collected at the individual level, let's say credit score, we've phrased all of our questions to use the individual as the unit of analysis. But whenever possible, we've tried to phrase the questions to be as expansive and comprehensive as possible, to take into account an individual's wider financial circumstances. So again, if you take a look at the questionnaire, you'll see that the individual is the default, it's the unit of analysis, but indeed we do strive to capture the greater context in which the individual lives. I had a question around whether the financial health score is correlated with household income. It is indeed correlated with household income. As I mentioned when I was talking about demographics, we do find that income and age, as well as education, I don't think I mentioned that, those are 3 of the demographic features that have the largest association with financial health scores. But again, I want to point out that simply having higher income, simply having a bachelor's degree or greater, does not mean that individuals will indeed be financially healthy. I have a question around healthcare costs as well, which I'll get to in a moment. Question around how budgeting was defined in the study. Budgeting, we again phrased it to be self-reported, so we simply said, are you using a budget or some sort of a plan to track your spending? And for those of you who are financial coaches, who are financial practitioners, I know that budgeting is one of those very fraught questions, because budgeting, simply we're using the B word, if you will, does not necessarily capture the extent to which individuals are indeed thinking through their finances, planning ahead, and engaging in informal types of budgeting. But we did the best we could with that survey question, and if anybody has feedback, we're always open to including it. So I have a number of additional questions, but in the interest of time, let me keep moving forward, and I'll do my best for any of you who submitted questions that I'm not answering. I'll do my best to follow up with each of you after this webinar. Moving forward, in the 2018 baseline report, we also took a look at wider socioeconomic societal trends that were shaping financial health in America. And we did this for a number of reasons, but the one I'll call out here is in recognition of the fact that there's a lot simply beyond an individual's control, structural systemic issues that play a very large role in shaping financial health in America. So here we look at three of them. We look at the generational prosperity gap, increasing cost of living, and the price of instability, and how these three trends, which I'll go through briefly in a moment, shape financial health in America. So the first of these trends is the generational prosperity gap. And we found that individuals who struggled financially growing up are less likely to be financially healthy today than those who did not struggle financially growing up. Much like other socioeconomic indicators, poverty, etc., we find that this mobility gap exists. And we find that this gap is so pronounced, that this trend is so pronounced, that individuals who say they never struggled financially growing up are nearly twice as likely to be financially healthy today as individuals who said they regularly struggled growing up. Those numbers are reflected in blue at the top of the screen. 43% of those who said they never struggled growing up are financially healthy today, compared with 22% of those who said they struggled regularly. Again, this methodology is based on our financial health score. And we find that Black and Hispanic Americans that this trend has a particularly pronounced effect on Black and Hispanic Americans. So of Black Americans who said that they struggled financially growing up, only 18% of these individuals are financially healthy today. We find comparable rates amongst Hispanic individuals who said they struggled financially growing up. Only 14% of these individuals are financially healthy today, compared with 29% of white Americans who struggled financially growing up and indeed are financially healthy today. So again, much like poverty, other socioeconomic indicators, we see that Black and Hispanic Americans benefit from far less mobility in terms of opportunities than white Americans, and there are likely a lot of reasons for this that we begin to explore in the report. However, we find that certain factors, certain characteristics and opportunities tend to offset some of those mobility effects that I just mentioned. So of respondents who struggled financially growing up but have a college degree, those individuals have a college degree today, those individuals are 5.5 times more likely to be financially healthy than they are to be financially vulnerable. Of respondents who struggled financially growing up but have predictable income, these individuals are 4.1 times more likely to be financially healthy than financially vulnerable. Similar trends of a somewhat less magnitude when it comes to steady income. And let me quickly define predictable and steady income for you here. Predictable income, we phrase that question as those who, or to what extent could you regularly predict your income over the last 12 months? Steady income was more a measure, less of predictability, but more of a measure of the volatility of that income. So over the last 12 months, to what extent did your income change versus it remained steady month to month? And you'll see those definitions come up again. So again, these factors are somewhat heartening. The analysis is indeed initial, but point to the fact that education and that employment opportunities may be able to offset, potentially mitigate some of the structural issues around the lack of mobility that those who grew up struggling, and particularly those who are Black and Hispanic, enjoy around financial health. The second trend that we looked at is how the increasing costs of living are challenging Americans' ability to lead financially healthy lives. And here, because our data is not causal, we looked purely at correlations, and because our data is not yet longitudinal, we relied heavily on secondary data sources for this analysis. So we considered our findings within the context of what we know to be true about the economy as established by other sources. So for example, this trend we looked at against the backdrop of the fact that over the last few decades, the costs of basic living expenses, specifically food, housing, healthcare, education, have been rising steadily while employees' wages have stagnated. And against this backdrop, we explored the extent to which our respondents, those who struggled to afford these three basic necessities, housing, food, and healthcare, the association that had with their financial health. And we found a large association between the struggle to afford these three basic expenses, housing, food, and healthcare, with financial health. So those who said that they struggled to afford housing in the last 12 months, those individuals were 22.8 times less likely to be financially healthy than those who did not say they struggled to afford housing. Same with food, at 20 times an association. Healthcare, those individuals who struggled to afford healthcare, 9.8 times less likely to be financially healthy than those who did not struggle to afford healthcare. And we found that those who struggled to afford those basic necessities were far more likely to report that their finances caused them high financial stress. So here at the top of the page, you can see how we worded those questions. And for those of you who are familiar with the CFPB's work, with their financial wellness work, you'll notice that we actually pulled these questions directly from their survey to allow us to compare our data to their data. And so this slide shows you that those who say they often struggle to afford housing, food, and healthcare, that's represented by the light blue bar on the left-hand side of each chart, those individuals are far more likely to say that their finances cause them high financial stress. So the percentages on this slide show the rates at which individuals who struggle with these basic necessities, the rates at which they report high financial stress. Again, the size of that light blue bar shows this correlation between the struggle to keep up with the day-to-day cost of living and financial stress. And we found that financial stress, it cannot be considered within isolation. This financial stress is actually having a very high impact on other aspects of an individual's financial lives. So those individuals who reported trouble keeping up, in this case, I gave an example of rent and mortgage, but the same trends hold true for food and healthcare. Those individuals who say they often struggle to afford paying their rent and mortgage, and also report high financial stress. 27% of those individuals say that their financial stress is having a high impact on their physical health. 42% say it's having a high impact on their mental health, 47% family life, 18% school and work performance. Really, I think, going to show how interrelated, how interconnected all aspects of an individual's financial life really are, that you cannot simply separate or segment or consider in isolation an individual's financial life without thinking about the wider context in which they live, without thinking about their more general ability to keep up with housing, food, healthcare, and other expenses. And finally, last but not least, the third trend that we looked at is the price of instability, and how Americans who experience instability in the workplace are falling behind as they strive for financial health. And we looked at this trend, again, considering what secondary data sources could tell us about the changing nature of the American workplace. And we wanted to look at this trend in particular, given the wider economic context of this great risk shift, the idea that risk is being increasingly transferred onto the shoulders of employees and away from institutions such as employers, such as government, et cetera. And that has come to pass with the gutting of benefits in the workplace, with the more volatile schedules, unpredictable pay, which we'll look at in a moment. So against this backdrop, we explore this association of various forms of employment conditions with financial health, and once again found a correlation or an association with stability in the workplace and financial health. And so we found that employees with predictable income were 2.5 times more likely to be financially healthy than those with unpredictable income. Same thing with steady income, 1.7 times more likely to be financially healthy than those with volatile income. I already defined those two, but again, predictability is the extent to which folks could predict their income month to month. Steady income was the extent to which it changed month to month. Predictable hours, 1.6 times more likely to be financially healthy than those with unpredictable hours. Again, 12-month look back, to what extent were you able to predict your hours? Consistent or flexible schedules, those with consistent or flexible schedules, 1.5 times more likely to be financially healthy than those with employer-dependent schedules. Here we define consistent or flexible schedules as the extent to which your schedule either remained consistent, did not change over the last 12 months, or if it did, was it at the employee's discretion, or was it at your employer's discretion? And the final employment condition we looked at here is stable employment. That was another self-reported metric, asking the likelihood that respondents thought that they would lose their job or retain their job in the next 12 months. So that was not a look back, that was a look ahead. And again, we found correlations between each of these 5 types of employment stability and financial health. And because each of these conditions are likely quite related to each other, we went a step further. We conducted a multiple regression analysis to hold constant each of these, as well as other factors such as income, such as age, such as participation in the workforce. And we again found that these correlations persisted while holding other variables constant. And then we looked at the association of these employment conditions by income group, because we wanted to get a sense of, well, is this does a stable work environment matter for everyone, or is there a particularly pronounced effect of an unstable work environment for some income groups in particular? And we found that while these associations persisted, so here we're looking at point increases in financial health scores. That's again because we did this regression analysis. So while we found that those who experienced stability in the workplace on average had higher financial health scores than those who did not, we found that indeed one group, that was individuals in the middle of the economic spectrum making between $30,000 and $59,000, represented by that second medium colored blue bar, second from the left bar in each of those charts, that these individuals actually experienced the most benefit from stability in the workplace. So taking the second chart, for example, looking at steady income, individuals making between $30,000 and $59,000 a year, those individuals had financial health scores on average. Individuals in that income group with steady income had financial health scores on average 11.2 points higher than individuals in that, than individuals in other groups who indeed had higher financial health scores than those who did not have steady income. And again, the size of that medium blue bar, second from the left on each of these graphs, again points to the fact that those in that middle income group, $30,000 to $59,000 annually, these individuals may indeed benefit from the most from stability in the workplace. We also found, in terms of the good news, that certain benefits offered in the workplace can offset the impact of instability in the workplace. And so here we looked at just 3 of those benefits: health insurance, paid parental leave, paid sick leave. Again, we found that individuals making in that middle group, $30,000 to $59,000, that the association, the increase in financial health scores, if you will, 8.4, 6.4 for paid sick leave, that boost in financial health scores is once again highest for that middle income group, really pointing to the important role for employers to play in improving the financial lives of Americans. So with that, I realize we almost are at time. We have a number of questions coming in, which I'm so thrilled about. I so appreciate the audience's engagement in this webinar. And I want to conclude by simply saying that this webinar was the first of a series of ways in which we are hoping to engage each of you. We're hoping that each of you engage with us. And I think the questions that all of you submitted are just a testament to the fact that this really is the first of many conversations. So let me conclude. Let me take the last couple minutes of this hour to provide you with a few concrete ways in which you can continue to engage with us around this work. The first is by sponsoring research. So we are always open to general sponsorship. If you appreciated Rob's overview of each of the funders, if you want to be a group of those esteemed funders, we invite you to come talk to us, come see how you can get engaged in general sponsorship. But beyond general sponsorship, we are also always open to funding of segment dives or topic deep dives. So the AARP Foundation report that we've mentioned a few times now, that's an example of a company who came to us and said, we are particularly interested in exploring the financial health of a certain group of individuals, and we'd like to put funding behind that work. If, again, your organization works with a specific set of individuals or is particularly interested in a specific topic, whether that's in workers in the gig economy or how folks are saving, how they're borrowing, we would love to talk to you about how we might do segment-specific, topic-specific deep dives. We're also open to doing proprietary analysis for your company. If you have a burning question that you're wrestling with at your company or organization, and you'd like the proprietary insights, you have no interest in publishing or funding something that's published, also open to doing proprietary analysis for you via our consulting channels. And finally, if you enjoyed this presentation, if you think your colleagues may benefit from learning more about the insights behind this work, please reach out to talk about bringing us to your organization to conduct a presentation, an interactive workshop, etc. For those of you who are unfamiliar with the CFSI Financial Health Score, I did receive a couple questions about this framework. Please do check out the toolkit. Take a look at how you may be able to use this very simple, very easy to use methodology to measure, track, and improve your customers' financial health, and then to be able to compare it to national ongoing benchmarks that we will be releasing through the ongoing data from the Pulse. Last but not least, in my final minute, I will leave you with a couple upcoming milestones and the link to learn more about this initiative. Stay tuned in a few weeks for the release of our first segment deep dive funded by AARP Foundation. Stay tuned as well for the public release of the survey data set. So I don't think I've mentioned this yet, but we will indeed be releasing the data from the underlying survey so your organization can explore it at your leisure. And then please do consider joining us at Emerge, our annual conference, which will be in Phoenix of this year, mid-May, to learn more about this initiative as well as some of the exciting things that CFSI and our network members are looking at. With that, I'll conclude by encouraging you to take a look at the website devoted to the Pulse and reaching out to myself as well as to Rob with any further questions on how you might like to learn more or engage more deeply in this work. Thank you so much for your attention, and I look forward to being in touch with you shortly. All the best.